Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Dr. Anita Kurian, who's our Assistant Director of Metro Health, and this is our COVID-19 update for the San Antonio community. We have some more good news this week. According to our weekly Progress and Warning Indicators report, we continue to go in a downward trajectory in the number of cases of COVID-19 being reported. In addition, our hospitalizations, ICU admissions, and number of people on ventilators have all decreased compared to last week at this time. This week, our positivity rate is roughly the same. It's now 5.0%. While we see some improvements in our hospitals, it's important to note our overall health system remains in the upper end of the high stress score, meaning there's a lot of volume in the hospitals because of COVID-19. With all this considered, our indicators are improving. So your work is continuing to pay off. Please keep masking up regardless of vaccine status. And if you're unsure about getting vaccinated still, I encourage you to consult with your healthcare provider, and you can visit covid19.sanantonio.gov to get answers to your questions about the vaccination. In terms of cases, today we're reporting 441 new cases of COVID-19. Our 7-day moving average now has gone down to 616. Thankfully, there are no new deaths to report tonight, and we have been below 100 new admissions over the last many days, so we're thankful for that as well. Below 100 new admissions per day. You remember those were over 200 just a few weeks ago. In hospitalizations, there are 723 patients in area hospitals with COVID-19. There were 72 new admissions the last 24 hours, 257 in the ICU, and 130 on ventilators. 80% of patients in area hospitals are unvaccinated, and we have 21 pediatric patients this evening with COVID-19. Let me turn it over to Judge Wolff.
Yeah, thanks, Mayor. And it looks like we're headed in the right direction, but we still got a good ways to go. I was out and got my vaccination last Friday at the Wonderland site. I was surprised how many people were there. I think we ended up doing 1,900 vaccinations on that day. That's the booster shot. That's the Pfizer booster. Moderna has not been approved yet. We did another 1,200 yesterday there, and then we've done about 900 so far today. So we're glad to see people getting out and getting boosted. That's those that are 65 and older, or those that have some immune problems or some underlying thing that presents a serious threat to them can also get that. It's interesting that they're working on developing a pill now that might take the place of the monoclonal antibody infusions that we're doing out at the Bexar County Expo Hall. Every time someone goes there, it's costing the taxpayers $2,100, and obviously it's the unvaccinated that are almost predominantly there. So the pill, if it gets developed right and comes along, should be a heck of a lot less expensive than that. There's a good report released by the CDC analysis. They covered 520 United States counties, and they found that if the school put in place a mask mandate, they were a much better shape than without it. A more detailed study of some of the ones in Arizona showed there was 3.5 times more likely to experience an outbreak if the school didn't mandate the mask. So that's why the mayor and I have been fighting so hard to protect children. And let me tell you what the impact has been since there's been so much misinformation on that, since there's been so much opposition from the governor and from the attorney general. As of September the 19th, we've had 154,444 school children pick up the COVID in the state of Texas. At that same time, 28,601 staff also have picked up COVID. So you can see the dramatic impact if you don't protect your school children. I've never been able to understand why people would oppose to protecting our school children by requiring them to wear a mask. We're on the right track on most of it, but still problems in schools, and we got a long way to go yet.
We do, and I appreciate that, Judge. And many of you have asked about the booster shots. for those who are eligible. Metro Health will be offering booster shots of the Pfizer vaccine to eligible individuals ages 65 or older, as well as adults 18 and older if you are considered to be at high risk of severe illness from COVID-19. And that starts tomorrow, Wednesday, September 29th. Eligible individuals can get a booster shot at the Alamodome drive-through clinic between noon and 8 p.m. Wednesdays through Fridays. No appointment is needed. However, individuals can also visit covid19.sanantonio.gov to make an appointment. Booster doses will also be given at all Metro Health vaccine pop-up clinics. And as a reminder, you've been hearing about the incentive program, the HEB gift card incentive. For those of you who have not received your second dose or your one dose of Johnson & Johnson COVID-19 vaccine, you are eligible to receive a $100 HEB gift card if you visit a Metro Health vaccine clinic. This incentive will be available until supplies last. Finally, to find a testing location near you, just visit the website covid19.sanantonio.gov. You can also call the COVID hotline by dialing 311 and hit option 8. Please wear a mask, get vaccinated, do it for yourself, do it for your family, and do it for San Antonio. With that, Dr. Kurian, myself, and the judge are available for questions.
Dr. Kurian, can you tell us what it would be like, what people can expect when they go to the Alamodome tomorrow for boosters? Was it the same process where people wait in their car? What are people going to have to do when they show up for a booster tomorrow?
It's the same process as was in place while the primary series were being administered. But I want to make it clear, we are bound by what FDA has authorized. So, meaning booster shots will be administered to folks who have received Pfizer vaccine as their primary series and at least 6 months have elapsed from their second dose. If you've received Moderna and J&J, you will be turned back. So please bring your vaccination card if that is available for us to verify your primary vaccination series. We will also be looking into the state registry to confirm that you've received Pfizer. In fact, you've received Pfizer.
So the eligibility is for people who are 65 and older and then 18 with an underlying condition. From what I understood on Friday, the CDC also authorized people in high-risk jobs to get it as well. Is that good? Are people in those jobs able to get it at the Alamodome?
Yes. So the eligibility, we will follow the CDC recommendation. So CDC recommends that everybody 65 and older should get a booster. If 6 months have elapsed since their second dose of Pfizer, everybody 18 and older in long-term care facilities, and 50 to 64 years of age with underlying medical conditions. In addition, people who are in those high risk, at risk for severe disease because of their occupational or institutional setting and 18 and older may also receive the recommended booster dose.
Dr. Kurian, could you repeat the safeguards y'all have in place for ensuring that people do not mix and match vaccines?
As I mentioned earlier, we will be looking for your vaccination card for the verification. We will also be looking into the Amtrak, which is the state vaccination registry for verification and validation.
Are people receiving booster shots eligible for the HEB gift card incentive?
Mayor had already pointed this out. The incentives is only for those receiving those primary vaccination series. Folks receiving booster shots are not eligible at this time to receive the incentive, $100 HEB card.
So far, we've only heard that the Alamodome and Wonderland Mall are giving out the booster shots. Are you aware of any other places, private clinics, private doctors' offices that are giving out the booster, or are these the only two sites right now?
I have anecdotal evidence, but I have not confirmed this myself. But there are other places in the state that are doing it.
Dr. Kurian, are you concerned about the breakthrough cases for hospitalized COVID patients? It's increased from 1% vaccinated to 20% vaccinated over the past 2 months.
So
I checked some numbers. Those are incorrect. Yes. We've started tracking that on August the 3rd. It was 88% were unvaccinated. We've moved anywhere from 90s to the 80s. Never was 1%. So go ahead and answer the rest of the question.
And I was going to say, so long as the pandemic lingers, we expect the breakthrough cases to
Sorry, pulling up my notes here really quick. So, Mayor, my understanding is the Texas Supreme Court has allowed an eviction diversion program to continue until December 1st. Could you tell us what that would mean for San Antonio residents and what the impact it would have for people who may be facing eviction within the next couple of months?
Yeah, and I know this is impactful for not only city residents but county residents as well, so I'll toss over to the judge, but just very quickly, it means for our program at the EHAP that the city is administering that if a tenant seeks protection or seeks relief through the Emergency Housing Assistance Program, they are going to have that case abated. It provides some additional peace of mind for folks who are still impacted by COVID or are having trouble paying rent.
Yeah, I think the best way to say it's a voluntary program that it was established in September of last year, and it permits eligible landlords and tenants to resolve their issues and forsake a eviction if they both go to the JP court and they reach some sort of an agreement to use the rental assistance program. So it's a voluntary one that you have to work with the landlord and the tenant to make it work.
Mayor, can you tell us if the Emergency Housing Assistance Program is going to get any further support? My memory is a little fuzzy on when it was slated to end based on funding, but I understand a few grants had been applied for. Do you have the status of those?
No, we have kept that fund operating through the life of this pandemic, and our commitment, again, we're working from what are our principles. No one should lose the roof over their head because of this pandemic. That's where we're operating from, and so we've kept that fund going by adding additional resources to it throughout this pandemic, even since last April. But as of today, we have funds in that Emergency Housing Assistance Program that are forecasted to be sufficient through the end of the year, and we'll keep an eye on it. We have had some additional assistance from federal grants. The majority of those funds are coming through our Recovery and Resiliency Program.
So if there are people who just don't know what to do and they just maybe got an eviction letter, an eviction notice, and they feel like they don't have anywhere to turn to, what should they do?
Call 311 and talk to one of our navigators. Anyone who needs assistance for any number of reasons because of COVID can call 311, and we can help navigate them to the right resource, whether it's the Emergency Housing Assistance Program or something else. In addition, we have housing navigators who are at the JP courts to intercept in case someone needs assistance and is already at the court. We will try to get that landlord and tenant together to come up with a solution so nobody has to be to lose their shelter during the middle of this pandemic.
Judge, can you tell us how many people have received the monoclonal antibody treatment?
Well, the other day it's around 5,000. I talked to him just a little earlier today, and we think we're over 5,600 now. Again, to remind everybody, we open up at 8 o'clock when we began processing people. We stay open to 6:30. Actually, they don't get to shut down to 8:30 because there's a lot of work to do to be shut down. And it's open 7 days a week. So that's a lot more people. I think the most we had in the previous spread of COVID was around 3,000. So a number of people are taking advantage of doing that to ward off having to go to the hospital. So it's expensive, and it's being used a lot, though.
Dr. Kurian, could you tell us what advice you would give to people concerned about getting the COVID-19 vaccine on the same day as a flu shot?
So flu shots can be co-administered with the COVID-19 vaccine. In fact, we recommend that as being a best practice, so people can be up to date with the vaccination when they show up for COVID vaccinations. Just make sure that the site of administration of these two vaccines are different. It can be on the same arm, at least an inch apart, or on different arms. And I want to just clarify the earlier question. I did get confirmation, Retail pharmacies, CVS, Walgreens, and HEB are also offering boosters at this time. So the mass vax sites are not just not the only sites offering.
And in most cases, people need to have their vaccination card. Like, what happens? And I know you talked a little bit earlier about the state registry. If they don't bring their vaccination card or they can't find it.
Mm-hmm. If they can't find it, we should be able to locate them in the state registry so long as the provider who administered the shot has entered it. But we'll handle this on case-by-case basis. But for most part, folks should show up with your vaccination cards.
Mayor, later this week, on Friday, October 1st, or at least in the month of October, CPS Energy is expected to restart disconnections for residential customers who have not been able to make payments during the pandemic. To your knowledge, is that still the plan for the utility? And if so, what are your thoughts on it?
First of all, we don't want anybody to be disconnected. So there is feverish work underway to connect everyone who is behind on payment with the payment plans that are available. And it should be noted, anyone who is behind on payment that signs up for a payment plan or assistance program will not be disconnected. We can't say that any more loudly. So get some help from those assistance programs. Call CPS if you want to call. We want to make sure everybody is taken care of. Those programs, I asked about this yesterday. Apparently have had great success getting people connected, but we still have some folks out there. So that was the plan, was to start the communication efforts back in the summer. Those have been ongoing. If folks simply are not responding, though, then they risk being disconnected. But we are trying to make sure that everybody who needs assistance is able to get it and nobody gets disconnected.
That's all we have tonight. Thank you.